Now, Republicans are working on their own versions of health care reform, and in the House, the Republican Study Committee is prepared to introduce a bill tomorrow. Here with an exclusive preview is Republican Congressman Tom Price, who was a practicing doctor before heading to Washington. First, Mr. Price, in just a sentence or two, what is the Republican Study Committee?
Well, the Republican Study Committee is the group of House conservatives, about 114 of us, self-identified conservatives in the House, that really is the policy, the engine for the House of Representatives on the Republican side.
We get an exclusive preview of the summary of your bill. Let me go through this fairly quickly if we can, but
Sure.
Pillar number one, you say access to coverage for all Americans. Give me a sentence or two on that, please.
Well, the status quo is unacceptable because the costs are increasing and folks are concerned about either losing their health insurance if they change their job or they lose their job. So we believe that it's imperative that each and every American have the access to health care coverage that they select, not that Congress selects for them or that the government selects, but that they select. The way that you do that is through the tax code and make it financially feasible for every single American to have health coverage.
Pillar number two, coverage is truly owned by the patient.
When you own and control your own health insurance policy, then you are able to take it with you. That solves the portability issue so that you can't lose it if you change your job or lose your job or if your financial status changes. You own and control your health insurance policy, therefore it goes with you and your family.
Number three, improve the health care delivery structure.
It's imperative that we have appropriate structure that changes so that we have wellness, preventive programs and the wellness programs that are in place. Also making certain that we incentivize high-quality care, have transparency in the system.
And rein in out-of-control costs.
In order to rein in costs, you've got to stop the practice of defensive medicine. Clearly $300 billion or more each and every year. That means liability reform has to be at the hallmark, one of the hallmarks of a bill. That's what isn't happening on the Democrat side. We propose that. We also make certain that we pay for our bill by making this a priority. The federal government ought to prioritize, have health reform as a priority. We make it so it's paid for.
All right, and a bit of new news that has just come out I wanted to get your response to. Senator Baucus over on the Senate Finance Committee, the lead Democrat, announced that a bipartisan group, that those 6 folks that Ezra was talking about a moment ago, have submitted a new draft reform plan to CBO, the Congressional Budget Office. And they say the price tag of their plan, which we haven't seen yet, is below $900 billion over 10 years and would ensure coverage of 95% of Americans by 2015. What do you think?
Well, the devil's in the details, as you know. That plan would come in about $400 billion less than the House plan. But we do know that the House plan and the Senate plan in the past has had significant decreases in Medicare so that you get hundreds of billions of dollars in, quote, savings, but actually that's rationing of medical care for seniors. That's unacceptable to us. And also unacceptable is any significant tax increase on the American people or on small business. We believe that's a job killer and also harms the entire health care system.
Let's take a quick look at a political cartoon. I don't know if you can see it or did see it in the Washington Post, but it shows basically members of Congress in an ambulance running away for the August recess from U.S. health care as the patient lays in pieces at the bottom of the screen. Do you think the public is starting to get a little tired of hearing, the arguments and wondering really where this is going, if anywhere?
Well, I know the public's tired of that. I would suggest, I didn't see the cartoon, but I would suggest, though, that what we're running to is the patient. If we go home over August and talk to our constituents, talk to the patients of America, and get their input on this entire process and on the policy that's being talked about here in Washington, we will have a better product in the fall. Again, the status quo is unacceptable. We've got positive solutions, patient-centered solutions, and we believe that if we're able to have an appropriate opportunity to present those to the American people, then the American people will select solutions that put them in charge, not the government or insurance companies.
Well, maybe you've partly answered my next question with that, but Republicans are coming up with their alternatives. In the end, why bother? Isn't it Democrats that are going to be able to get something passed or not? You don't have the majority, they do. So why are you even bothering to come up with different plans?
Well, the role of the minority is twofold. One is to hold the other side accountable, make them do what they said they were going to do, or hold them accountable when they don't. That's the frustration of the American people right now. They don't believe that this Democrat majority is doing what they said they were going to do. And then second, it's to provide a contrast, to provide that positive solution that the American people can embrace. When we do that, then we believe firmly that the American people will say, hey, those are the folks, those are the guys and gals that are putting forward the real positive solutions. And then there's an election coming around in 2010. It's important for folks to be able to say, those are the people we want to have in charge leading our country.
We have just another minute or two, and I wanted to show another graphic of a chart the Republicans put together supposedly diagramming the House Democrat health care plan. I think you've probably seen this, but it is a screen full of little pipes and squares. And true or not, which I haven't been able to dissect this and see if we agree that this is, a neutral view of what the plan is. But I think whether Republicans or Democrats try to reform health care, that's a major fear on the part of a lot of Americans, that we're putting a ton of bureaucracy in and nobody will understand it. It's just going to get messed up.
Absolutely. On one side of that chart, you see the patients, and on the other side, you see the doctors, and then all of those things in the middle. And all of the things that are colored in the middle have a different color to them, are different kinds of programs and different kinds of commissions and entities, bureaucrats, if you will, that will be in place. Those are new programs, new federal programs. That's not what the American people want. American people want a system that allows them and their families to work with their doctors, compassionate and caring doctors, and come up with the right decision. Not the government, not insurance companies.
All right, quickly, as of today, your guess, what are the odds that Congress will pass a bill by the end of this year that is similar to what President Obama has been pitching for the past months?
Well, I don't think that the Congress or that the nation wants a government program. They don't want a government takeover of health care, and I don't think that they want the kind of taxes raised to the level of $800 billion that is currently in the House proposal that the President has endorsed. So if you're talking about that program, I don't think that has a chance of passing. If, however, you're talking about a program that embraces patients and allows them to be the decision makers in the health care arena, then that has a wonderful opportunity to pass. We've got the bill, we believe. We look forward to having that debate.